Welcome to the class, Dr. Shanti. We'll start with today's oncology module. We have total 4 tasks. So the first task I'll show you. You have 2 minutes to read and 10 minutes to perform. So this is the first slide. Your time starts now. There's only one slide.
Okay.
Your time is up now.
Okay. Hello, I'm Dr. Shanti, one of the doctors in the oncology clinic. May I confirm your name and age, please?
Doctor, I'm Margaret Walker. My age is 63, doctor.
Yeah, so may I call you Margaret? Is that be fine?
Yes, doctor. That's fine, doctor.
Yeah. Mrs. Margaret, I can see from your GP note that you are having some itching in your vulva, and then you had been given treatment by your GP, and then some tissue sample has been taken, and today here we are to discuss the report. Is that right?
Yes, doctor. Maybe around 2-3 weeks back, some test was done. Some tissue was taken, and I was told that I'll have a meeting with the consultant. So that's why I came today, doctor.
I'm aware of that, Mrs. Margaret, but unfortunately, my consultant is not available now. So it's that be fine if I continue the consultation today.
Yes, doctor. No issue.
Okay. Can you tell me a detail regarding your problem, how it happened, and what is the cause of the your problem?
Doctor, actually, I had itching since maybe around 6 months or more. So I visited GP. GP has given me some treatment, some ointment was given. I guess some
Mm-hmm.
steroids were there, but
Mm-hmm.
there was no much relief with that. And then he suggested that I need to get some special tests done. So I met Mr. Patel here, and some tissue was taken, doctor. That's all.
Mm-hmm. Mm-hmm. Along with that itching, do you have any pain, bleeding?
No, bleeding not there, but
Mm-hmm.
itching is very severe, doctor. Itching is
Mm-hmm.
continuous itching.
Okay. And and you're telling that this treatment is, I mean, not effective for you, right?
Yeah, some steroids were given, but it was not very effective.
Okay. I need to ask also few detailed questions from you. Previously, how is your your smears were normal before?
Yeah, doctor, all my smears were normal.
Mm-hmm. And how long you have been like a menopause?
I think around 3-4 years, doctor.
Mm-hmm.
Yeah.
Mm-hmm. And some of my questions will be very intrusive. And are you with someone now?
Actually, my partner passed away maybe 6 months back. I Yeah, and I have my three kids, but now they are at different places for their job work. They come in between, doctor.
Okay, okay, sorry to hear that. And you have any medical problem, any medicine you're taking?
No, 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 doctor. I'm fine. Otherwise, I'm quite active also.
Mm. Any surgeries before?
No, doctor.
Mm. And any allergy to any medications or any other items?
No, no, no.
And regarding your social habits, do you smoke?
Occasionally, doctor. Even I drink occasionally, but not on a regular basis.
Okay. And so, how is your support at home?
Yeah, actually, my kids are now taking care, but they are also busy, but quite okay, doctor.
Hmm. And do you feel low or depressed in last 4 weeks?
No, doctor, no, no.
Mhm. Okay. So, thank you so much for giving me this information and coming to your concerns. Mrs. Margaret, I can see that you are alone here, and I have confirmed your name, your NHS number in the tissue sample report. And would it be okay if you want to call someone to be with you, as I have to give you a lot of information today?
No, actually, even no one is there with me, but you can go ahead, doctor. I can listen. Is there anything serious, doctor?
Actually, Mrs. Margaret, I am sorry to tell you that the report has come. It is not a good news for you, and the tissue sample report says that you are having the cancers of the vulva.
Oh my God, doctor. Cancer, doctor, down below. You mean my private part where the tissue was taken, doctor?
Yes, Mrs. Margaret, it is. I'm really sorry to tell you
Eh,
that.
Oh, doctor. Yeah, I'm just shocked now. I'm shocked.
Okay, so take this glass of water and this tissue.
Yes, doctor. Yeah, doctor.
Are you?
Can you?
Yeah,
Yeah.
read it.
No. What we need to do now after this?
Yes, so yeah, Mrs. Margaret, I'll be telling you in detail everything. And are you okay that we should continue this consultation, or would you mind to give other appointments so that I can discuss?
Uh, no, doctor. You go ahead because I need to discuss with my children also. They'll ask me, so I need to discuss with them. So I need information also.
Okay, so this is this is the cancer of the vulva, and the good thing is that the it has not spread to other parts of the body. Okay, so it is a very small area. It is less than 1 millimeter the depth of invasion, the spread of the cancers. So it is the prognosis is good because it has not spread to other parts, but still we need to do further investigations to rule out whether it has spread to any other area or not. Okay, so we'll be doing your care will be under the care of the multidisciplinary team of doctors, including my consultant, also cancer specialist doctor, and also this vulval specialist doctor, and we also have some specialist nurse will be there, and this tissue doctor will be there, and the x-ray doctor, this is the team of the doctor specialist doctors will be involved in your care. Are you with me?
Yes, doctor. Yes, I'm getting the things.
Yes. So I'll be giving referral within 2 weeks to the this specialist vulval clinic, where this team of doctors will see you, and they will do further investigations, and also they will tell you the proper which is suitable for you or the treatment options. Are you with me?
Uh, Doctor, you mean to say you won't be able to tell me anything about the treatment, doctor?
Yeah, yeah, I'm going to tell, but this will be the plan. Okay.
Yeah. Yes,
Uh,
doctor.
Yeah, so mostly the plan, the most this management of this condition is the surgery. So we remove the part which is involved with the lesions of the cancer, and along with that, we also take the some normal tissue surrounding this vulval region, around 1.5 to 2 centimeter normal tissue, because there is increased risk of, it can also progress to progress to there can be recurrence of this cancer. So we make sure that we have the clear zone of the tissue. Okay, so as this lesions is very small, so it can, we call it like wide local excision. It will be done in the tertiary care level, and so after which again we have to see, take the some samples from the groin or from the lymph node. These lymph nodes are like small structures which are involved in the defense system in our body, and which drain the fluid. So we have to take the samples whether it is involved or no, and if it is involved, then we have to remove that as well. Okay, and
So,
other thing is, yeah.
no, doctor, you mean to say it is going to be a big operation? You mean to say you will cut the near my private parts where you find some problem, and also my groin also you are planning to
Yes,
cut, doctor?
yeah. As per the report, this is not very extensive disease. It is a very small area. So the part which is involved, and along with that, that normal tissue around 1.5 to 2 centimeter will be like wide local, will remove, and then we'll send for the tissue analysis. Okay, and
Yeah.
then we will be doing sampling, just sampling of your groin lymph node. If it is involved, then need to remove. Otherwise, no need to remove. Okay, and if there is any disfiguration of the body, there will be scarring. So and during the surgery there can be also pain, bleeding, infections. So if it is more area is affected, so we'll be also involving the specialist doctor, we call it plastic surgeon. So in which they will be helping you to do the some grafting of the skin, that area. Okay.
Yeah, doctor, but you do we have some any other chemotherapy, radiotherapy for this? Because my friend underwent some chemotherapy for some CA breast or something like that. So
Yeah.
will I need that, doctor?
Actually, that is also a good question, and there is also other options. Like whenever the lesions are big, so and involve the white part.
Time is up. Time is up. Time is
Yeah.
up.
Yeah, so I thought this is actually small, so I did not go to that chemotherapy, radiotherapy. Like, it's very minimal. That's why I was
No.
looking to,
Yeah, actually
yes,
main focus what you it was there, but the role player is instructed to ask certain questions that you should be firm that surgery is the treatment for
yes, yes,
less than 1 millimeter depth
yes.
invasion. Okay, so chemotherapy
Hmm.
and radiotherapy will not be required. Actually,
Yeah,
role player
yeah,
is afraid, means in further discussion, role player is very scared of this chemotherapy and radiotherapy because she has seen that her friends had a miserable
hmm,
life. Okay,
hmm.
and she will get convinced for the surgery also. So the completion of the task is going to be very, very important. Okay,
Okay.
see, if you read the task, no, explain the biopsy results. That means our explanation should be proper. Then discuss
Yes.
the further management plan. Okay, and in
Hmm.
discussion of the further, we will have additional investigations. We'll have
Yes.
additional referral plans, and then
Yes.
the surgical management. Okay, these
Yes.
are the main thing, and address her concerns appropriately with the empathy. Okay, so these three different things we need to cover over a period of 10 minutes. So please,
Okay.
when actually we read the task in 2 minutes, but
Yes.
we have to concentrate not only this information, but even hurriedly you should not miss any point here. Okay, so that is the
Hmm.
most important thing. Okay, now we'll go ahead with the feedback first. Okay,
Yes.
now
Hmm.
coming to the information gathering, actually this was a very simple task. Am I
Yeah.
audible to you?
Yes. Yes.
Just a
Yes.
moment. Yeah. See, this was a very simple task, and we were expecting a routine information gathering. However, it is a postmenopausal lady. So, in
Yes.
postmenopausal lady, n number of things. One which are related to menopause, and second which are related to any kind of malignancy, especially genital tract malignancy. So, we have to ask related questions. These are a couple of things, including the weight loss and all, we need to ask, and also other medical surgical history. Most of the histories you have covered. Okay, but the history of HRT is going to be very, very important, because she told that she just had a menopause 3 to 4 years back. Anything
Yes.
which comes with the itching, we should ask any kind of discharge, smell, etc. You did ask, I think, some bleeding or something like that. You did ask about
Yes.
it. Okay, so that is going to be, so just look at the age and the phase. She is on a perimenopausal phase, so we should cover that as a that particular phase as such. What are the other issues come around that particular age? Okay,
Mm.
that is the main important. And always weight loss and all at this particular age group, in with any kind of malignancy. Okay,
Yes.
second thing is that I felt that you were little slow. The task maybe was simple, but
Yes.
that gave the one good thing, that there was a better understanding of the role player, whatever the information you were giving. But if you can make use of the paper and pen, especially this depth of invasion less than 1 millimeter, that you need to explain and convince the role player that it's not an advanced thing. So don't worry, because what happens once you talk about the cancer, your role player will definitely show some kind of reaction to it. Okay, and we have to take out that particular trauma of the role player. Okay, so one of the good thing is that this is the you have to explain with the help of paper and pen. See, this is the skin, this is the normal structure. We are finding it, but this what we call is invasion in medical term. That means the cancer cells have not gone beyond 1 millimeter from the surface. Okay, so that particular thing you should be able to explain. Rest of the thing, like pap smear and all, you have asked. I'm not sure about the blood group, BMI, whether you missed or something like that.
I,
Mental health, you definitely.
yeah, but
Mental,
blood group I did not say.
yeah, yeah.
Yeah, blood BMI.
Mental health, you ask how you feeling and all. Okay, so that was the thing. And second thing is that we this smear you have definitely asked, but yeah, and MDT definitely you have explained what the MDT will be there. Okay, and wide local excision. Only thing is that you have explained it wide local excision in the proper term, but that also if you can explain with the help of paper and pen, that will be better. Okay, somewhere in the between, I feel that the empathy is lacking. Maybe it became little monotonous in the history taking sort of thing, one after the other, one after the other, one after the other. But later on, you picked up on the empathy part. Okay, so just keep it that when we are dealing with some emotional thing, no, this empathy is there always in your talk. Okay, so we'll just see what exactly is expected in the task. So information gathering, we need to ask about the duration, nature of vulval symptoms, ask about the past treatments tried. Okay, this one you need to ask. I'll go through. Is that okay if I go through your papers, or do you have any papers? I would like to go through it. Okay, because sometimes she has received. It is a case of lichen sclerosis. She has received the steroids, but not a potent steroid she has received. Okay, so what kind of and what was the strength? Okay, and whether it was pertaining to the diagnosis which is mentioned. Okay, then apology was good, means the consultant is not, so situational awareness was there in your task. So check for the pain, discharge, bleeding, explore regarding the sexual history, menopausal status, then ask past medical, surgical or family history, explore psychosocial concerns, living alone, daily activities. Okay, so these are also very important things. Clarifies patient's understanding of biopsy and current expectations. Okay, then coming to the patient's safety, emphasizes importance of surgery. Here you should be more firm. You have explained the proper thing, but the purpose of asking radio and chemo was that only, that no, at this stage it is not required. Okay, then explains need for complete excision, then addresses wound care, healing, pain, clarifies no need of urgent lymph node surgery. Okay, so this particular information you should be able to, like there are two things. One, lymph node involvement you can get it preoperatively by doing certain investigations. Ultrasonography is there, and you can do scans also. So CT scan and all, and look for the lymph node involvement, and less than 1A per se they are not required. Okay. Reassures about low risk of spread and allergy. Okay, that these will come under the second points. Then applied clinical knowledge correctly explains squamous cell carcinoma, clarifies stage 1A invasion is less than 1 millimeter, describes wide local excision, explains no need for node dissection in early stage, states no chemotherapy or radiotherapy is needed, mentions MDT discussion, and talks about prognosis, recurrence, and follow-up. So this actually you did not get the time, the prognosis, recurrence, and follow-up. Okay, but basically that you can conclude over a period of this less than 1 millimeter will always have a good outcome. Okay, but we'll suggest you some certain follow-up, and I'll give you the information. So that actually a closing also you can do in that particular way, closing of your task.
Yes.
Then communication with the patient, delivers diagnosis clearly and calmly, avoids jargon, uses reassuring phrases, picks up and responds to emotional cues. This you have done it properly when the role player, had a sudden shock of the cancer and all. You showed proper empathy, ask for the given the doctor and all. Allows time for the patient to ask questions, provides honest and positive framing, checks for understanding throughout, shows empathy throughout, maintains non-judgmental tone, uses appropriate language and manner, offers written information, ensures shared decision making. So most of the things were there, but there was little fluctuation in the empathy, and then written information, the leaflets and all, because the time got over. But this will come at the end, and always help the shared decision making. Okay. So that was about the first task. Okay, so actually it was a very simple task, nothing complicated in this first task. Should we go ahead with the next task now?
Yes, yes, yes.
Yeah, time starts. I have one more slide.
Again, slide is there.
Yeah. Time is up.
Yeah. Okay, so hello, I'm Dr. Shanti, one of the doctor in the gynecology oncology clinic. May I confirm your name and age, please?
Doctor, my name is Jean Foster, and I am 63, doctor.
Yeah. So can you call you Jane?
Yeah, that's fine, doctor.
Yeah. So, okay, Mrs. Jin, from your GP letter, I can see that you have some problem, some itching in your down below, and also you are given treatment, and then some tissue sample has been taken, and today you are here to discuss the report. Am I right?
Yes, doctor. I think maybe last week or something like that, test was done. Some tissue was taken, and I was told that I'll have a discussion in today's meeting. So I just want to know whether the report is available and what about the reports. That's the main concern.
Yeah, sure. Mrs. Sin, actually, I apologize for the absence of my consultant because due to unavoidable situation, she's not here. So today I will be, with her permission, I will be conducting this consultation, and after which, as soon as possible, I will give appointment with her. Is that be fine?
That's fine, doctor. That's fine.
Yeah. So at the end also, I will give you a patient information leaflet, and I will write back to your GP as well, and I will give appointment with my consultant. Okay. So coming to your concerns, I can see that you are here to discuss the report. But before that, whether it will be fine if I'll ask you a few questions so that I will know you more detail.
Yes, doctor. You can ask, doctor.
Right. So can you tell me regarding your problem?
Doctor, I just had a continuous switching my private parts. So I went to GP when GP told me maybe some diabetes or something like that. Some tests were done, but they were
Mhm.
normal, doctor, nothing as such. Then GP gave me some cream for local application, and
Mhm.
I tried that maybe 2 3 months I tried, but there was no relief. So I was told to meet consultant. So I think maybe 10 days back this test was done, tissue tests. That's why I'm here, doctor.
Okay. So along with this itching, do you have any pain or bleeding, any discharge from the down below?
No, doctor, but the itching is continuous itching, doctor. That's the main thing.
Mhm. And besides that, do you any skin discoloration is there down below?
No, because of persistent itching, sometimes the area becomes red.
Mhm.
That's all, doctor.
Mhm. And do you find the similar itching other parts of the body?
No, but what I noticed recently is these lesions are became little whitish to pink in color. That's the thing.
And do you feel like any swelling in other parts of your body, like in your back passage or in your vagina?
No, doctor. No.
Okay. And do you feel like recently you are losing your weight or decrease appetite, like anything?
No, doctor. I'm quite okay.
Mhm. And regarding your periods, when was your last period? Your menopause?
I think around 5 years now, maybe more than that, doctor.
Are you up to date with your smears?
Yes, doctor. My smears were always normal, doctor.
hmm And are you using any hormone replacement therapy, any medications?
No, doctor. No, no,
Mhm. And before any surgeries before?
no, no,
Any allergy to any medications?
no.
hmm And do you have any medical conditions like diabetics or thyroid disease or any other,
GP
conditions?
got GP investigated for all those things, but nothing as such. No test was positive, doctor.
hmm And regarding, have you been pregnant before?
Yeah, doctor. I have got 3 kids, doctor. All are grown up now.
hmm And regarding your social habits, do you smoke?
No, doctor.
Okay, any alcohol intake?
Socially, doctor.
hmm And do you do what do you do for your living?
I'm retired bank manager, doctor.
hmm And how's your support at home?
Yeah, my partner is very good, supportive, doctor.
hmm And do you know regarding your BMI and body mass index?
I think it is 29, doctor.
hmm And in last few weeks, do you feel low or depressed? Yes. Hello.
No, 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 doctor, no.
Okay, yeah. Okay, so thank you so much for giving me this information. So coming to your concerns, so I have confirmed your name, your NHS number, and in this tissue report, and it confirms that it's yours. And I can see that Mrs. Jane Foster, I can see that you're alone here. Since I have to give you a lot of information and that information is very important, that would be fine if you call someone to be with you to attend this discussion together.
No, doctor, it's okay. You can share the things with me, doctor.
Mhm. Okay, so from this report, I can see that you are having a conditions called, extramammary Epages disease in medical terms. That means this is skin lesions of your vulva. That is the precancerous lesions of the skin of the vulva. Are you with me?
What do you mean to say? Is it a cancer, doctor?
Actually, this is a very rare and slow-growing disease, and it is not a cancer, but it's a precancerous. So, if it remains untreated, it may progress into the cancer. So, it is early before the cancer. Are you
Okay.
with me?
Yeah, yeah,
Okay.
yeah. Yes, doctor, I got it now. I got it.
So sometimes this can be directly from the skin, so we call it is primary. Sometimes it can be also associated with other cancers in our body, like cancers from the breast or cancers from the back passage or the neck of the womb, or it can be from the water pipe. So it can be associated with other cancers as well. Okay.
Oh, okay, 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 doctor.
Okay, so regarding your management, Mrs. Jane, that your management will be under the care of multidisciplinary team of doctors. I will refer you within the 2 weeks referral system to the specialist available clinic, and the team of doctors, including my consultant, gynecologist, then tissue specialist, also the cancer specialist will be involved in your care, right? So first of all, as I told you, we need to rule out the other cause. Other causes of this problem, because it is associated with other cancers as well. So we need to rule out. Okay.
Yes, doctor. So you mean to say I'll have to do certain test, doctor?
Yeah, we have to do certain certain blood tests, like we have to go to a blood test, tumor marker. This is special type of proteins we need to do blood test. Also we have to do screening for this that breast cancers or your neck of the womb, and we have to do some camera test from the bypasses and for the pipe, water pipe, and also neck of the womb and the vagina. And also we need to do some imaging like ultrasound or special scan like a CT, MRI, and sometimes if it is like some tissue sampling from the glands, we need to do to rule out whether it is associated with any other cancers. Are you with me?
Okay, doctor. Yeah, yeah. I'm getting,
So
doctor.
yeah, and regarding the management of these conditions, this is a very the prognosis is very good, but if it is untreated, it can progress into the cancer. So we need the treatment as well as the need of follow up is very important. Are you with me?
Yes, doctor.
Yeah.
Yes,
So
yes.
for these cases, of the first line of treatment would be the surgery. So removing the part which is involved, and along with that some normal tissue surrounding the normal tissue, like a clear margin will be removed. Then again, we'll be sending this tissue for the tissue sampling, or to see whether how far the involvement of this lesions. Are you with me?
Yes, yes, doctor.
Yeah.
Yes,
So
yes.
besides that, you also during the surgery you may have some pain, infections, and bleeding, and some discomfort. And also before that, we have some general measures for the vulval care. So you should avoid, the soap bubble bath, or using deodorants, any irritant, and that keep that area clean. And then better to use the cotton underwear, and it should be comfortable. And during at home, so it should be like comfortable without putting any underwear, so it will be the I do not rub anything. And if you have itching, so better to keep your nails short. So these are the few general measures we need to do. Okay. And you will be following up by the vulval special clinic, and any time we'll be giving you 10
Time is
minutes.
up. Time is up.
Yes.
Yeah. See, overall, this was a very good station. The flow was absolutely good. You have covered many points. Okay, especially the referrals, the underlying malignancy, additional investigations, the rapport with the role player was good. Information gathering was correct. Okay. Only thing is that let us go from the task as such. Okay. Explain the diagnosis to the patient. Okay, you have explained what exactly this is, but again, most of the discussion was a verbal discussion, but try to explain in a pictorial manner that will
Yeah.
reflect in a better way. Okay, then discuss the management option. Management will include additional investigations, the MDT care, appropriate referrals, ruling out underlying malignancies. That is also safety points, and then answer her questions and address any concern. Okay, so overall, this particular task was very good. Here, I would suggest that you explain. You don't use this medical terminology, but what has been seen under the microscope that the cells are not normal. They are enlarged in size, which generally suggests this particular condition, and some spatial staining has also been done. Okay, just use because it is positive for something, it is negative for something, and you have been given the diagnosis also. So you need not know much about this, but some spatial staining has also, some spatial stains also have been used by the doctors, and they have come to a conclusion, or the tissue doctor have come to a conclusion. This is this particular, and it is non-invasive, and this you need to explain properly. Okay, this is non-invasive or okay. So these are the things in the explanation you can improve upon on this. Okay, basically, what happens when you read the task properly? Now, most of the clues are there in the task only, and another just a small this particular never say he or she consultant. Okay, it is
Okay.
just say consultant. My consultant is not available, because sometimes what can happen, like in a previous task, it was given Ahmed Patel. Okay, and if we are prepared in our own way, then it may not match, and what will happen? The situational awareness will not be there. You got it? So just keep less confusion. Okay.
Yes.
So that is the just a small suggestion, nothing specific.
Yes.
Because here also there no consultant's name is given. Okay.
Yes.
So just go on using the consultant, my consultant, GP. Okay,
Yeah.
that you address in a third way. Okay.
Yes.
Now let us go one by one. Coming to the information gathering, explore the current symptoms, duration, treatment failure, etc. Ask about the other skin changes. You have asked about it, pain, sexual impact. I think sexual activity here in this task you did not ask. The first task you definitely ask, but this
Yes.
task, okay, clarifies past. But this is very important at this particular age from the UK lifestyle point of view. Okay, clarifies past medical and family history. Ask about lifestyle and concerns, and explores the understanding of previous consultations. Okay. Then applied clinical knowledge currently explains extra memory patches disease, states it is non-invasive and in situ. Okay, so it is not deep. Explains the management is a wide local excision. Mentions this one particular thing is very important. There are chances of recurrence, but you have mentioned about the follow-up. Follow-up is meant for the recurrence. Okay, so recurrence risk we need to discuss. Then discusses possible association with underlying malignancies. Example, colorectal, urinary tract, breast. This also you have means here you have passed this particular station, especially the domain of what you can say communication with the colleagues. You will be referring this to rule out all these things. Then mentions the role of imaging or the further investigations. Okay. Then communication with the patient. Avoid jargon. Use simple phrases like early, surface level, not straight. So these words are very important in your discussion. Okay, especially when there is no invasion. Always, there are some changes which we consider abnormal, but they are at surface level only. Okay, especially in pre-malignant conditions. Okay, you can use this particular word. Then addresses questions calmly. Cancer, surgery, recurrence, acknowledges emotional impact, offers written information, supportive care, checks understanding, and invites questions. Empathetic and respectful, gives time for the patient to absorb information, offers referral support options, and maintains professional tone. So this was quite good for you task, and emphasizes need for excision, mentions MDT involvement, discusses monitoring and recurrence, flags need for ruling out internal malignancy, and discusses surgical safety and wound care. So this all you have taken care in your task, including the vulval care. You have general vulval care. Don't miss that. You have covered what the general in all stations of the vulva. Okay, generally the general care of for the vulva you can include. Okay, applied clinical knowledge, this we have discussed. Yeah, so that finishes the second task also, relatively simple task. Okay, shall we go ahead with the next task,
Yes,
or you?
yes, yes.
Yeah,
No, no, it's okay.
yeah, we'll go ahead.
Yes.
Your time starts now. There's one more slide also. Slide.
Okay. 1 second. That previous one. Okay. This is the one. Mm.
Your time is up.
Okay. Hello, I am Dr. Shanti, one of the doctor in the gynec oncology clinic. May I confirm your name and age, please?
I'm Claire Thompson. My age is 43, doctor.
Yeah, may I call you Mrs. Claire?
Yes, doctor. Yes.
Yes. So, Mrs. Claire, I can see that from your GP letter that some of the investigations has been positive for you, like we call it a BRCA, and you are here to discuss the further management of your case, as you have the family history of some cancers in your sister. Am I right?
Yes, doctor. Actually, my sister was diagnosed with some cancer. I think there was a breast cancer, then there was ovarian cancer also. And then we were told that we also need to do some test. So I have undergone the test, and unfortunately, some test was positive. So GP told me I need to meet the consultant here. That's the reason I'm here. I also searched something on the internet that some test which was positive has got something further, some surgery to be done and all. So I just wanted to know what exactly the things are.
Yeah, I can understand that. I apologize for the absence of my consultant. And today I'll be taking your consultation with your permission, and then I will give appointment with my consultant as early as possible. Is that be fine?
Yeah, that's fine,
Yeah.
doctor. That's fine.
So regarding your sister, I'm really sorry to hear that. How is she's doing now?
She is fine, doctor. But treatment is always going on. Investigations, follow up. That's all, doctor.
Okay, so in your case, do you have any problem at present? Like you have regarding your weight is decreased, or you are having a decreased appetite, or anything of any such problem you have at present?
No, doctor, nothing like that.
Mhm. And previously, whether you were pregnant before, how many children you have?
I have got two kids, doctor. One is around 12 years and another is 10 years, doctor.
Hmm. And whether you were like exclusively breastfeeding to them?
Yeah, I had exclusively breastfed my kids, doctor.
Hmm. Any contraception, hormonal contraception you are using?
No, no, my husband uses.
Okay. And are you up to date with your smear?
Yes, doctor, my smears were always normal, doctor.
Hmm. And any future plan for your pregnancy?
No, doctor, no, not
Mhm.
currently.
Mhm. Okay. So when is your last period?
Around 10 days back, doctor.
Okay. So coming to the, do you have any surgeries before?
No, doctor, no surgeries.
Any allergy?
No, doctor.
And any medical conditions you have?
No, doctor, no.
Hmm. And I can see from your note that your sister had the breast cancer and also the ovary cancer. What about the other members, or your mother? Any other person is having the similar
Uh,
cancers?
no, doctor. Actually, my mother expired in the accident, so we don't know when we were, around 10, 15 years. That time only she expired. So I don't know about mother.
Mm-hmm. Yeah, sorry to hear that. And regarding your social habits, do you smoke?
No, doctor.
Any alcohol intake?
No.
Hmm. And how is your support at home?
Yeah, my partner is very good, supportive doctor.
Hmm. And do you feel low and depressed in last few weeks?
No, no, nothing like that, doctor.
And are you aware of your body mass index?
It's 27, doctor.
Okay. And regarding, are you with someone now?
Yeah, I stay with my family, my partner. I got two kids, doctor.
Hmm. And any difficulties in your sexual life,
Oh,
pain
no,
or
doctor. No, no, nothing like that, doctor.
and you have any bleeding in between your period?
No, doctor, no.
Okay, so thank you so much for giving me these informations, and I have also confirmed your name, your NHS number, and the report here with me. I'll be discussing regarding this report, which the GP has sent to me. So first of all, I can see that. Certain like special genes which is responsible for this type of cancers, like your sister had the ovary cancer and also breast cancer, and whether your sister is tested for the similar gene.
Yeah, yeah. She was also positive for some test, and that is why we were also asked to do same test, doctor.
Mhm. Okay, so and you don't have any symptoms, and you are also positive for this specific gene, which carries the increased risk of cancers in breast and also in the ovary. But let me tell you that even if without any specific gene, there are also the in general population the risk of ovary cancer can be around 2% without any specific gene positive. Okay. So
Uh, you
when a
mean
person is,
you mean to say even if the test is not positive, then also there will be risk.
yeah, there will be risk around 2%. But whenever this test is positive, the risk increases. Okay,
Okay,
whenever
okay.
this happens, and then there is this gene is positive, so that risk increases. So and there are some options available. So there is surgical options. So as in your case, already you have completed the family, and you don't have any further wish for the future pregnancy. There is also options like we can go for the surgery where we remove the tube, both the tube and also both the ovaries. So this will we call it a risk reduction surgery. Okay, so it can be done by a keyhole surgery, And so it is a safe procedure, and it can be done by experienced hand, and there are less complication, but sometimes there can be some complications of bleeding, injury to the surrounding structures, and also sometimes there can be infections can occur, but after the surgery, so as your age is almost like 42 or 43, so if we remove this ovary, what will happen is that the ovary will not produce the hormones, and we call it like a menopause in a sense, like you will not produce any hormone. So you will have symptoms like you will have hot flushes and dryness of vagina, there will be sexual difficulties, and you need to go for the hormone replacement therapy till the normal menopausal age, almost like around 51 years. Are you with me?
You mean to say my womb will also be removed?
No, only the only your your ovary, and also your ovary and the tube.
Okay,
Okay?
okay. So the womb will not be removed because you said I will have the menopause. So I was thinking that if the womb is there, then that
Symptoms,
will.
because ovary we are removing, so that's it, you have to go for
Oh,
like hormone replacement therapy. Okay. And
okay,
yeah, so for the then some of the screening for breast cancer also is available. So in that case, because you are positive, so breast cancer usually screening is done between 50 to 70 years, but in your case, as you are positive, we'll be doing screening like a mammogram, we will do some kind of scan, so will be done early for in your case. Okay, so I'll be referring you to the specialist clinic for that. And so let me tell you, after the removal of your this ovary, there is also chances of it does not eliminate the cancer of 100%. Sometimes this can occur in the we call it peritoneum. So it is a special type of around this ovary. Some types of tissue is available. This tissue can also develop the cancer. So there can be a possibility of cancer even after removal of the ovary. Okay.
okay, okay, doctor. You
Yeah.
mean to say still even if I remove
Yeah.
the ovaries, then also there is
Still
little
there is
chance.
chance.
Yeah,
Still there is chance. So I
doctor.
will give you information
Yeah,
leaflet
but
document or
when can I undergo this surgery? Means can is it mandatory to do it now, or maybe after 6 months I can think of the surgery?
yeah, it is done between 35 to 45 years of age during this, once you have completed the family, and still there is time, you can decide, and you can discuss it with your family and with your partner. And also I will refer you to my consultant as well, and I will refer you to the genetic counselor, and already it is positive, they will be in a better position to speak regarding this surgery as well. Okay, and I will also give patient information leaflet, and you will have better idea regarding this.
Thank you. Thank you. Time is up.
Thank you. Yeah.
This station was quite good. You have covered all the aspects, and the closure of the station was also proper. So within time, you have finished the this particular station. Okay. So let's go to the feedback properly. I just felt that somewhere in between, when you were explaining the report, there was
Yeah,
little
I was thinking whether DRT or
because
I was thinking.
you have been given the this GP letter. Okay, you
Yeah.
have been given the GP letter, and the GP letter is mentioning about the investigations and all. So there was little incoordination here in correlating all these things. That she is a GP referred case. So I understand the GP has referred you. Your sister had these particular some cancers, and some test has also been done. So we are going to discuss about it. So little incoordination I noticed, but otherwise the overall tempo was quite good. Okay.
Mm.
Then let us go. Regarding the this bilateral salpingo-oophorectomy, so you just first thing, ovary is okay, but still if you can
Yeah.
use egg baskets, that is better. Okay.
Okay.
But ovaries, even the normal patients do understand. Then
Yeah.
about their question, when you say about the menopause, no, it is always be clear with the diagrammatic way that what you are going to remove, what you will be keeping. Okay.
Yes.
And basically, unless indicated, no other. So per se, uterus is not at fault, so uterus will not be removed. and
Yes.
this is also prophylactic. This, but there is a little chance even when you do prophylactic, there still there can be malignancy in the specimen. So final will be on microscopy, whatever we remove. Okay, that will also be sent for the tissue testing. Okay, there is a little risk in that also. I think some risk has been quoted in the talk. I forgot that particular risk, but some risk is quoted here also. Okay, but that is
Mm.
too much. If you
Yeah.
want to be very specific, if you just highlight that, we will be
Yeah.
sending for the microscopic testing by the tissue doctor. Okay. So rest of the task was quite good. Okay. Now let's see about information gathering. Explores family history of cancer. Here regarding any breast issue and the any swelling in the tummy, just to rule out ovarian and the malignancy. Those you can add in the history. You definitely ask about the weight loss and any other cancer, but especially related to the breast, you can ask whether she is doing self breast examination. Did she notice anything abnormality in the breast, any
Mm.
discharge, any lump,
Mm.
and
Mm.
abdominal also, lump, etc. Okay.
Mm.
Then asks about the patient's fertility status. You have asked whether she has completed family contraception, desire for more children. Ask about the
Yeah.
periods, menopausal status. Explores the understanding of BRCA and concerns. So here some genetic information. The test is about the gene, and
Yes.
presence of this gene indicates that those people who are positive are likely to have certain malignancies. Okay, and this can be prevented by doing this. This is the particular age group in which, and you have mentioned 35 to 45 is the right age to remove it. Okay, once she has
Yes.
completed the family. And screens for breast symptoms or previous breast screening. Okay, so this you need to add.
Yes.
The next, patient safety, mentions benefit of early surgery. Okay,
Yes.
discusses the risk of surgical menopause, that you have explained very well. Explains safety of HRT in BRCA1. So this lady will require HRT even if she is BRCA1 positive, but there is no breast cancer, so she can take this HRT. Okay, mentions
Mm.
specialist referral and counseling. Avoids
Mm.
unnecessary uterine surgery unless indicated. So unless any other associated indication is there, she will not have hysterectomy. Okay. Then communication with the patient, uses non-alarming, clear language, responds empathetically to fear of cancer, clarifies the cancer is not inevitable, explains options and personalizes them, checks understanding, invites question, provides reassurance, written support is offered that you have done at the end, respectful,
Mm.
empathetic approach and honest but positive, encourages shared decision making and offers support system and referral. So this all you have covered in your task. Okay. Now
Mm.
explains the BRCA1 mutation. There is an increased breast and ovarian cancer risk in these patients where this particular test is positive. Explains RRBSO. So bilateral salpingo-oophorectomy is required.
Mm.
Recommends RRBSO between the ages of 35 to 45.
Mm.
States surgical menopause and HRT consideration. This also you have covered. Mentions
Mm.
breast surveillance or preventive mastectomy. Okay, I think breast surveillance also you did mention. Okay,
Really. Mm.
explains referral to MDT and genetic counseling and follow-up. This also you have covered at the end, no doubt.
Yes.
So these all points you have covered. So this is a very well performed station. Okay,
Thank you.
so that finishes third station, and now we have got a last station. Okay, so
Yes.
should I start the station? Yeah,
Yeah. Yeah. Yeah.
yeah,
Start.
yeah. Started. Time starts.
Mm.
The time is up.
Yeah. Hello, I am Dr. Shanti, one of the doctor in the gynae clinic today. Am I speaking to Mrs. Margaret Brown, who is 61 years old?
Yeah, yeah. I'm Margaret, doctor. Yeah.
Yeah. So is that be fine if I call you Margaret?
Yes, that's fine, doctor.
Yeah. So Margaret, I have your GP letter, and I can see that you are having some missing in your down below, and you have been given some treatment, and so your GP has referred here for the further management as there is no improvement in your symptoms. Am I right?
Yeah, doctor. Actually,
Yeah.
almost a year I am suffering now. 8, 9 months is over, and I've been to GP because of the teaching and all. But
Mhm.
in spite of using some, treatment, I was told that it will be a fungal infection. I was told that
Mhm.
we'll do some tests for the diabetes, but nothing has worked out. And
Mhm.
later on, there were some sort of cracks and some white patches were also there.
Mhm.
It's become very difficult down below, doctor. And
Mhm.
I also not able to intimate with my partner, and there is a little disharmony sort of thing, doctor.
Mhm. I can understand your difficulty, and really, I'm sorry for that. And do you have any, any discharge or bleeding down below?
No, doctor, I
Like
did
it.
not notice such kind of discharge or bleeding or something like that.
Mhm. Okay, so and regarding your periods, whether how long you are having the, I mean your menopause.
Many maybe 7, 8 years back,
Uh-huh.
my periods stopped. More than that, maybe.
And are you up to date with your smears?
Yeah, doctor, my smears were normal, doctor.
Mhm. And previously, whether how many children you have previously, whether you are pregnant before,
Yeah, yeah, I have got 2 kids, doctor. Yeah.
and any surgeries before.
No, doctor, no, no surgeries.
And you said that there is no diabetic, any other medical conditions?
No.
Yeah. So I can see from your note that there is like high blood pressure. Is that right?
Yeah, I am taking medicine, doctor, and I think it is under control because I'm following regularly with my physician, doctor.
Mhm. And regarding your social habits, do you smoke?
Occasionally, doctor.
Mhm. And what about taking alcohol?
Socially,
Mhm. And any allergy to any medications?
no, doctor, no.
Mhm. And how is your support at home?
Yeah, my partner is very much supportive, doctor.
Mhm. And do you feel low or depressed in last 4 weeks?
No, 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 doctor, I'm fine.
And are you aware of your body mass index?
It is 28, doctor.
Mhm. Okay, so thank you so much for giving me this information. So if you don't mind, I will examine in the presence of a saffron. Already I can see the GP has examined you, but just to make sure that I like to see the general conditions
Yeah,
of
yeah.
yours.
Yes,
Yeah.
doctor, that's fine, doctor.
Yeah. So, and to see the down below, what type of lesions is this? Or should take the swab if it is any discharge is available. Okay, if
Yeah, yeah.
present.
Yes, doctor.
Yeah.
Yes.
So, as per the history and the examinations findings from the GP, like the most probable diagnosis of your condition, so it is like tuberculosis in medical terms. Are you with me?
Yes, doctor, but can you tell me what exactly this condition is, doctor?
Yeah, yeah. This is the in this is the skin conditions of the vulva, and in which the skin of the vulva become very thin and whitish. Okay, because of that, and it will cause itching as well. Okay?
Yeah, yeah.
Yeah. So because of this condition, this is skin conditions, and if it is not, it is a very it is not a cancer, but it can be treated. It is a good prognosis after the treatment, but if we are not treating, it can progress into the cancer conditions, like around 4 out of 100 can progress into cancer. So for that we need to have the regular follow up. Okay, so for your case, so because of this, we need to take care of you in the vulval specialist clinic, and with a team of doctors will be managing in your care. So my consultant, gynecologist, and the special skin doctor will be involved in your case. And the most the management option will be like, first of all, we have to go for general vulval clinic, vulval care. So avoid this bubble bath or soap or any deodorant, and better to use the loose fitting cloth underwear, and avoid any you can use the substitute soap so that it will make a soothing of the skin. So after which the management plan will be the treatment will be like cream, like we have the steroid. So this steroid is called like we have got clobetasol, and this is 0.05%, and usually it is a tube. So this tube is, it contains around 30 gram, and you have to use it for at least for 3 months. Okay.
Okay,
This
doctor.
is yeah, and you have to use very small amount with the tip of your fingers, and first month you have to use it daily,
Mhm.
and the second month you have to use yeah, alternative days, and the third month you have to use twice in a week. Okay. And other your follow-up will be after 3 months in the specialist vulval clinic, to see mostly whether you are improving your symptoms or not, basically, and to see whether you have any the resistant to the symptoms, or you are developing any other any other lesions, to so that we have to do the further investigation. We need to do the tissue sample to rule out any cancers. Okay.
Okay, okay. So
uh,
this some test we have to do it now, or we have to take the I have to take the treatment first.
Yes, yes. Oh, yeah, not now. We have to do the treatment first, because before we don't know exactly what type of cream was given, whether the this specific steroid or this clobetasol was given or not. So we don't know. So first of all, these 3 months we need to do with this treatment. After 3 months, we'll review you and see how is your, say, improving or your symptom, or not. If you are not improving, then we can go for the tissue analysis.
Okay,
Okay.
okay, doctor. Yeah,
Yeah.
yeah.
Will give you patient information leaflet. I will also give you appointment with my consultant. I will give you 24/7 contact number as well. And in case you have any problem, you can come on contact immediately. And there are other options as well. So we have got so laser therapy, photodynamic therapy, and sometimes we have got some emollient to soothe the skin. These are the other options. Special type of substitute soap also is available, which will make your skin, so hydrate your skin, and it will become smooth your skin. Okay.
Yeah, yeah. Yes, doctor. Yes.
And yeah, so yeah, these are the our plan. So any questions so far you have?
No, doctor. No. I just understood that I have to take some apply some medicine
Yes,
there, ointment,
yes,
and will continue the treatment for 3 months, and the frequency will go on reducing for the
yes,
ointment, and then if required, then I'll have to do some test as you mentioned.
yes,
So
yes.
that is what I understood, doctor. Yeah.
Yeah.
Yes. Yes, doctor.
Thank you so much for speaking to me.
Yeah. Thank you. Thank you.
Yes. Yeah.
Yeah. Good. You still have 1 minute and 30 seconds. So this was, but you
I think
have
this is a
to
small session. I think lichen sclerosis is very small, I think.
small and very structured things are
Yeah. So
no,
nothing much to speak, I feel.
but you have covered most of the things. I just noticed that you did ask about the mental health here. Okay, mental health is going to be
And
no, it is
quote I
very
have
yeah.
which, yeah.
You did ask,
Mm.
but sometimes the role player can be a lonely lady and all,
Mhm, mhm.
because some psychiatric or mental health association is known with this lichen sclerosis, and autoimmune conditions you need to rule out. There is
Yeah, your voice, in between, I'm not able to hear your voice.
I think there is some system related issue most probably. Now is it okay or still just
Yeah.
is it okay now? Is it okay?
Yeah. Yeah, yeah, it's okay.
Yeah, yeah, yeah. Autoimmune disorders.
Mhm,
Autoimmune disorders. Anemia. These are the
mhm,
couple of things.
mm. I think why I'm not able to hear. Let me put maybe. I'll put earphone. I cannot hear.
I will also do so. Am I audible now?
Yeah, yeah.
What I was saying is anemia, autoimmune disorders, that also we need to look into it. Okay. So let's talk about the information gathering. Duration and progression of symptoms. So 9 months of itching and soreness is there. Description of the symptoms: itching, burning, skin cracking, pain, and intercourse. Okay, effect on daily life, sexual function. Here the information is volunteered by the role player
Yeah.
only. Past treatments, tried and response. Okay, menopause status and HRT use. HRT, I'm not sure. Did you ask in this task? Somehow I missed
Chat,
that.
chat, I did not say.
Yeah. But menopausal,
Yeah,
you definitely ask.
yeah, yeah.
Yeah,
Yes,
okay.
yes.
Then rule out red flag. Always, this particular age group, including if you are dealing with urodynamic, never forget hematuria. Okay. And here
Okay.
the bleeding, ulceration, weight loss. Okay.
That was,
Because here both cases, you are likely to have the patients between 60 to 70 years. Okay. Here, no doubt, this lady was also 61 and there was only one lady
yes,
with 43 years. Okay.
yes.
So when you have 60 plus ladies, always think of some malignancy. At least questions should be there. Then communication and interpersonal skills, use of clear non-technical language, acknowledging the patient's embarrassment and emotional distress, reassuring manner and addressing fear of cancer sensitively, checking understanding and allowing questions, giving reassurance about the treatment effectiveness, and normalizing the follow-up plan. So the follow-up plan was very clear, the medicines and all that also you have explained properly. Then coming to the management plan. So first line is a clobetasol propionate 0.05% ointment applied daily for 4 weeks and then go on tapering. Long-term use may continue intermittently, safe if used correctly. Use of emollients as soap substitutes and moisturizers. Regular follow-up initially at 3 months, then annual review in most cases. Okay. Importance of vulval self-examination and report any ulcer, bleeding, and lumps. So red flag signs you need to tell. Provide written information, leaflet, offer referral to vulval clinic if needed, discuss impact on sexual function, other psychosexual counseling if needed, and offer to involve partner or include chaperone if sensitive topic arises. So this part also you have taken care properly. Okay. So that finishes the last station on lichen sclerosis also.